Welcome everyone to another episode of Prostate Cancer Prostate Diseases Journal. We are here to talk about focal therapy with some specific technical points. And I'm here with Dr. Shoji, which will illustrate us a little bit his research and his main outcomes. And so please, Mr. Shoji, can you please introduce yourself? Where do you work and what are your main duties in the hospital? And introduce your research, please.
Thank you very much. Today, I would like to present my publication in the prostate cancer and prostatic diseases. So I would like to start my presentation using the slide. Okay. Can you see the slide?
Yeah, it's perfect. Go ahead. So it's very
okay. Thank you very much. So today I would like to introduce our study focal therapy using high-intensity focused ultrasound with intraoperative prostate compression for patients with localized prostate cancer, a multi-center prospective study with 7-year experience. So at first, I would like to introduce myself. My name is Sunao Shoji. I am a professor and chair in Department of Urology at Tokai University School of Medicine. So our university is located in Kanagawa Prefecture in Japan. So Kanagawa Prefecture is nearby Tokyo. So maybe 60-minute driving to the center of Tokyo. So my clinical experience in the field, so MRI transfusion image guided prostate biopsy 1,852 cases by today, and focal therapy with HIFU for localized prostate cancer 426 cases. So I would like to start my presentation. So for the patient with localized prostate cancer who had small lesions and low Gleason score, so active surveillance has been a viable consideration in the world. This slide shows the 5-year outcome of the MRI-based active surveillance in 672 patients. These patients exhibited PSA levels below 20 nanogram per ml and Gleason score of 3+3 or 3+4. So this slide shows a 5-year event-free survival in the patient who had visible lesion with Gleason scores of 3+3. 27.7% of the patient underwent treatment or experienced mortality. And the patient who had visible lesion with a Gleason score of 3+4, 66.2% of the patient underwent treatment or experienced mortality. These results support considering visible lesion, especially in the patient with Gleason score of 3+3 and 3+4 for potential treatment. However, the question arises, should patients with visible lesion undergo radical treatment? Notably, radical treatment might adversely impact both urinary and erectile function. So in previous report, combine of MRI fusion biopsy and systematic biopsy are able to detect 90 to 95% of the index lesion. Given this situation, there are high expectations for focal therapy. So I would like to introduce the treatment modality for focal therapy, high-intensity focused ultrasound, HIFU. HIFU produces ultrasound waves generated by spherical transducer delivering ultrasonic energy in pinpoint force millimeters in diameter. The distinct margin between the treated and adjacent untreated area is observed in the patient in the prostate treated with HIFU. So my former boss, Professor Uchida, were performing foreground therapy using HIFU. And I started focal therapy using HIFU after the introduction of the MRI transfusion image-guided biopsy since 2016. So I would like to introduce our technical development of HIFU. In our clinical experience of whole-gland HIFU, prostate swelling was intraoperatively observed on real-time transmonitoring. And we measured the changes of the prostate volume and interprostatic point shift before and after treatment in 44 patients. This slide shows the prostatic changes of the 3D model. And this line is a prostatic 3D model before the treatment, and this dotted line is just after the treatment 3D model of the prostate. So during the treatment for anterior portion with median 25-minute treatment, so median swelling and median shift were 80% and 3.7 millimeter. In histopathological finding of prostate cancer tissue treated with HIFU, the coagulative degeneration of the prostate cancer tissue involving gland and vessels with diffuse stromal edema. So how can we control interprocedural prostate edema for accurate focal therapy? So we came up with compression stocking for edema. So we started to compress the prostate from the rectum by the HIFU probe procedurally, so-called compression method. So we compared the change of the prostatic swelling and interprostatic point shift between the conventional and compression method. So in compression method, the balloon was expanded by the water from 80 to 200 milliliter. And this is a difference of the prostate model between conventional method and compression method. So during the treatment for anterior portion, the median shift and the median swelling were 21% and 4 millimeter in conventional method. On the other hand, in compression method, median swelling and median shift was 5.3% and 2.0 millimeter. So the prostatic swelling was significantly inhibited by the compression method in our experience. On contrast enhanced MRI at 2 weeks after HIFU, in conventional method, so anterior portion of the prostate, the blood flow was remained like this. However, in compression method, all prostate blood flow disappears in the treated patient. So further, the development of the HIFU device was significantly developed. So using 3D treatment planning, focus therapy can be planned on axial, sagittal, and coronal US image. And tissue change monitoring can predict interprostatic temperature during the procedure on real-time ultrasound image. And using safety alerting system is an early alert of rectal change, and rectal cruising system prevent rectal injury. So these development of the device was very, very useful for the successful treatment for focal therapy using HIFU. So in our clinical result of whole-gland HIFU at our institution, so the patient treated with HIFU with and without compression method, biochemical disease-free survival was significantly different in low, intermediate, and high-risk group. So using this compression method, so we treated focal therapy using high-intensity focal therapy for the localized prostate cancer patient. So I would like to introduce our result. So this slide shows the inclusion criteria. A patient who had a serum PSA level with and less than 20 nanogram per ml. A significant cancer that had been located using MRI transfusion image-guided transperineal prostate biopsy and 12 course transperineal systematic biopsy. And focally localized prostate cancer, a significant cancer within the left or right half or upper or lower half of the prostate. This slide shows the post-prostatal management. Urinary catheter was removed within 24 hours after treatment in all patients, and antibiotics are not administered post-operatively. This is a follow-up protocol. On contrast-enhanced MRI was taken at 2 to 4 weeks after treatment for the evaluation of blood flow in the treated area. PSA, function, and quality of life were measured at every 3 months after treatment within 24 hours, every 6 months after treatment after 24 months. And MRI was taken at every 6 months after treatment within 24 months and every 12 months after treatment after 12 months. And at biochemical failure, the biochemical failure was defined as Fink's atom definition. And MRI fusion biopsy and systematic biopsy with transperineal biopsy at biochemical failure. This is a definition of the recurrence. So biochemical recurrence was defined as Fink's atom definition, and pathological recurrence was diagnosed with MRI transfusion image-guided target biopsy and systematic biopsy at biochemical recurrence. So I show you the movie of the current process of focal therapy HIFU in our institution. This is an MRI fusion biopsy for the detection and diagnosis of the 3D location of the significant cancer. By utilizing the MRI transfusion image-guided biopsy, we determined the 3D location of the significant cancer. This red part was significant cancer. This is a HIFU probe. So black part is a transducer. In the transducer, so imaging and treatment part was included. From these treatment parts, so strong ultrasound was irradiated to the focus area. The size of the focus area was 3 by 3 by 12 or 3 by 3 by 10, and this significant small treatment. Okay, and at first we get the 3D model of the prostate using the ultrasound, and we choose the significant cancer location from the biopsy and HIFU modality. And based on this MRI fusion image guided HIFU planning, so we determine the treatment area. This is a computer graphic of the treatment process. This is a significant cancer, so we irradiated the high intensity focused ultrasound to the cancer area with a margin. So this is a monitor of the HIFU treatment. We adjust the this hyperechoic region. So we call the popcorn phenomenon. This is. So we adjust the power depending on the ultrasonic change. This is a contrast enhanced MRI after the treatment. The treated area was blood flow was disappear like this. So this slide shows the patient characteristics of the 240 patients. The patient number in low, intermediate, high risk group of 51, 107, and 82 patients. This slide shows the periprocedural data. So median procedural time in low, intermediate, and high risk group were 44, 44, and 48 minutes respectively. And 5-minute ablation time were 24, 22, and 24 minutes respectively. In oncological outcomes, the decreased rate of serum PS level in low, intermediate, and high risk group were 73%, 81%, and 83% respectively. The pathological recurrence during this follow-up period 87.8, 8.4, and 8.5% respectively. Of these patients, the number of the repeat focal therapy of the patient were 2, 5, and 2. And finally, so radical treatment such as surgery or radiation therapy free rate were 96.1, 94.4, and 95.1% respectively. This slide shows the longitudinal change of the score of urinary function. So just after 1 month treatment, the urinary function was deteriorated. But after 3 months, so these urinary function and erectile function were recovered to the preoperative line. This is application of the treatment of the study. So 2.9% of the urethral stricture, UTI 1.7%, urinary incontinence 1.3%, and severe erectile dysfunction 24%. So these complications were significantly superior than in the previous data of the foreground therapy. So as for the status update, so the Ministry of Health, Labor and Welfare approved focal therapy with HIFU as an advanced medical care in February 1st, 2023. A prospective pair match study with standard treatment is underway in multi-institution in Japan for evaluation of usefulness of focal therapy. This is my last take-home message. Advancement in techniques and technology have potential to significantly enhance clinical outcomes of focal therapy using HIFU. This clinical outcome of focal therapy for localized prostate cancer in Japanese patients shows promise for delivering long-term result. Because conducting a randomized controlled trial is not straightforward, a prospective pair match study with standard treatment would require was evaluation of usefulness of focal therapy. Thank you very much.
So thank you very much, Dr. Shoji. I think that you really made a wonderful presentation, especially for people who don't do it. I think that you made clear how to do research, because you went from the basics, you just developed the technique going from basic research, because you really analyzed the compression in a good manner in order, I think, to really fill the gap for maybe of classic focal therapy. So this compression device seems actually to reduce or improve, let's say, the accuracy of where you're treating the prostate. So I have a couple of questions for you, because I'm interested on the topic, and I think the audience also is very interested. So in your opinion, because I get that in Japan it's approved, now in Europe it's still, well, actually investigational, even if now the guidelines approve its use actually in prospective registries, not only in randomized clinical trials, because as you said, it's difficult to perform a randomized clinical trial with such different techniques. You know, the comparator is not easy. Both comparators or active surveillance of active treatments are difficult to compare with such a technique, which is somehow minimally invasive. So, what do you think? Because your results are not that bad, even in high-risk group. So, do you think that where would you position, in your opinion, this technique? Meaning, what are the patients that mostly benefit from these techniques, in your opinion?
Thank you very much. A great, nice question. So, in Japan, so situation of the focal therapy is very similar to European and US countries. So because not approved in insurance in Japan. So now we are doing the pair-matched prospective study of the focal therapy for the patient in Japan. So especially your question, especially the patient with visible lesion is keyword of the good candidate for the focal therapy, but not so high Gleason score. So 3+4 or 4+3, and with visible lesion, that's a good candidate. And maybe within the half prostate, right or left or upper or bottom, the half of the prostate visible lesion with a Gleason score 3+4 or 4+3. That's a good candidate because for such a cases, active surveillance is not so good and radical treatment is too much. So that's my thinking.
I think that you made clear where to position this kind of technique. I think that your results are very impressive, meaning in terms of maintenance of urinary function and of maintenance of erectile function, which are one of the most important things for our patients. So I really believe that this is a way. I think focal therapy has been there for a lot of times. We really need to give a direction to these techniques because nowadays the number of studies that have been made are a lot. Most of them are unfortunately retrospective. I think that a match pair comparison may be a good idea to actually improve the problems related to the randomizing patients, meaning that, as I said before, randomizing patients for these different techniques, it's very difficult. So beside, let's say, this prospective registry, do you have any other ideas for future research? What do you think that is missing in the literature besides that? What do you think that people should focus on this topic, especially because you're, I can say after your presentation, you're an expert of the topic.
Yeah. Okay, thank you very much. So maybe so multi institution, that means not only Japan, but also all over the world, registration of focal therapy data would contribute to analyze the usefulness of the focal therapy for the prostate cancer treatment. So, but there was no good registration. So, especially in Asia, because Asia and European characteristics of patient with maybe a little bit different. So I would like to build the Asian registry of the focal therapy in the future. It's my hope.
Yeah, I believe that you're right. I mean, there is a different population, so we may not apply the same results. Meaning the same results may not apply to Japan and to Europe or to Asia. So this is an important thing to keep in mind. I think that's an important thing when analyzing different results from different countries, meaning that the characteristics of the disease are completely different. So I think that we've went through all the important points of your paper. I think that people that will listen to it will have a very clear idea of what you do. Your videos are very interesting, so I thank you a lot for bringing this very nice and high quality presentation. So I will actually thank all the audience that will hear us, and I hope that people will benefit from this presentation, and we will soon have focal therapy in our guidance. So I thank Mr. Shoji, Dr. Shoji, for this very nice presentation, and I say a big goodbye to all the audience that is hearing to us. So this was another very interesting episode of Prostate Cancer Prostatic Disease podcast, and thank you everyone.